Sharma, and I just wanted to provide my kind of a wrap up of my clinical experience and just give my reflection on the experiences that I've had this semester. I'm really excited to share what I've taken away from this experience. So I will walk through each of the 8 course objectives and highlight some of my experiences and how they tie into a lot of the coursework that I've completed this semester, as well as the ANA Code of Ethics. So just to get started with objective 1 of the course, I met this by shadowing the ICU patient care manager. I was able to spend an entire shift with Nicole Baker at St. Luke's Carbon. And this experience gave me a lot of insight into how complex systems thinking, emotional intelligence, and critical care knowledge really intersect when it comes to managing patient care at this acute systems level. I also believe that the wellness hours that I completed tie into this. It helped me to kind of reinforce the importance of holistic self-care, something that we often teach patients when we conduct our education as part of the nursing role. But this also has to apply to ourselves. This kind of ties in with provision 5 of the ANA Code of Ethics, which discusses the nurse's duty to both themselves and to others, especially when it comes to promoting personal health and safety in order to deliver optimal care. Objective 2, I believe that my experiences during scholarship day and my visits to the Lehigh Valley Active Life Center helped me accomplish this objective. I was able to observe how community outreach supports both ethical and leadership growth. Engaging with older adults specifically in the senior community helped me to see how leadership means meeting people where they are, and to be able to advocate for dignity in every stage of life. It was really interesting to see the difference in how do I actually effectively communicate with, say, like a group of high schoolers during scholarship day. Maybe they have healthcare knowledge, maybe they don't. A lot of them are prospective nursing students, so they do have some knowledge base, but how can I effectively communicate my experiences and what I have to share with them versus how do I communicate that same information to, let's say the senior community. We just have to keep in mind those different experiences that people have when we're delivering patient care and communicating effectively. This really ties into provisions 1 and 2 of the Code of Ethics, which both emphasize respect for human dignity as well as the nurse's commitment to the patient. As we have seen, ethical leadership is about showing up, listening, and acting with intention. Objective 3 is to evaluate the effectiveness of communication, especially when we think about trying to reach those optimal outcomes of patients as well as their families. I was able to practice this during peer leadership, where I got to help out with the Nursing 313 simulations. And I was also able to do this while I was conducting blood pressure screenings at TCC. As I kind of hinted at with the previous objective, communicating in a way that's clear, respectful, and empowering, especially during health promotion activities or during general education, can influence whether somebody, let's say, follows up with their care, or maybe they ignore a warning sign, or they have a gap in their knowledge that causes them to miss something important. And for that reason, effective communication really is a leadership skill that we need to work on as nurses in order to help save lives. This also ties into provision 8 of the Code of Ethics, which encourages collaboration to protect human rights as well as to reduce disparities. Objective 4 is to critically analyze and integrate leadership research findings. When you think about a plan of care, I was able to meet this objective through research dissemination and the ethics dissemination work that I completed. Exploring current research as it applies to nursing leadership helped me see how evidence-based decision-making and ethical frameworks really do help shape better patient outcomes. During my capstone presentation with Maisha, we were really able to dig into how the ethical framework of non-maleficence and the leadership style on transformational leadership really come together to effectively improve patient outcomes. Specifically with our project, it was pediatric medication administration to reduce medication errors and improve patient safety. So both ethics and leadership are something that go hand in hand when we think about the patient experience. This also ties into Provision 7, which essentially states that we can advance the profession of nursing through research and scholarly inquiry. As future nurses, part of the job is to contribute to the evolving body of knowledge that guides both safe and equitable care for patients. Objective 5 is to apply the principles of ethics, advocacy, and teaching to the everyday care of patients and their families. And I had the chance to see this in action while I was observing the nursing supervisor, Lehigh Valley Muhlenberg. I got to see how advocacy, in many cases, can be embedded in the smallest decisions. Maybe it's stepping in to help a unit that is overwhelmed. Maybe it's stepping in to, provide some knowledge for maybe a new nurse that is having a problem. One thing that we did get to help out with was a malfunctioning PCA pump that was being used for a patient in a sickle cell pain crisis. As we've learned in our prior coursework, like that is a very, painful situation for a patient. And so being able to solve the problem in a timely manner while, collaborating with the nurses on the unit, the techs on the unit, really using teamwork to help solve the problem while also keeping that patient at the forefront was very enlightening. As I got to see, ethics were upheld even when things got chaotic, even when things were very busy. We were, running around the hospital doing different things. Patient safety was always at the forefront. And this really does tie in with Provision 3, which emphasizes the protection of patients as well as integrity in care. Ethical leadership really is about noticing the quiet moments where doing the right thing makes all the difference, even if it's the smallest of decisions. Objective 6, I met this by shadowing the ICU patient care manager. This is again an experience that was very poignant to me. It clarified to me that critical care is the setting where I personally see myself growing as a nurse. It's something that I'd like to pursue for, when I graduate. And it gave me ideas for how I would want to pursue leadership when I do get to that position. It emphasized that approaching problems calmly and with a systems mindset while keeping that patient or your patients in general at the center really does improve outcomes and helps things run smoothly. When you think about that chaotic unit where maybe that shift where everything seems to be going wrong, staying calm and being able to perform root cause analysis and really break down the problem makes all the difference as a leader. I also was able to meet this objective by completing my continuing education. I was able to tie in my career aspirations, and what I'm interested in to these clinical hours. I did join the AACN, which is the Association for Critical Care Nurses. And I was able to complete 6 hours of CE credits by researching topics either that I, were familiar from prior coursework or that I was just interested in. And it underlined to me that with anything in nursing, you have to have that commitment to always be growing, always be learning. It's a lifelong commitment, especially when you think of the provision. Of the profession. Objective 7 is to recognize the role of the nurse in policy making related to healthcare services at the local, state, and national level, as well as the global level. For me, this was met by attending the Harrisburg trip. It was really an eye-opening experience, and it gave me a sense as to how nurses' voices are truly essential in policy conversations, especially when you think about issues that we've learned about and that we face every day, such as staffing ratios, access to care, workplace violence. It really made me realize that advocacy at the bedside and at the policy level are extremely deeply connected. They go hand in hand. And it was really interesting to see that in practice at Harrisburg. So I thought it was a very, very interesting trip. This aligns with Provision 9 of the ANA Code of Ethics, which states that the nurse's responsibility to, it emphasizes the nurse's responsibility to advocate for both social justice as well as health policy. And finally, Objective 8 is to predict and describe potential ethical dilemmas within clinical, organizational, and professional nursing practice. And once again, I saw this during my time with the nursing supervisor and the ICU patient care manager. I also did actually see this during my time at Holy Family Manor. There was a bit of an issue where human resources was involved. And so I really did get to see how in solving that dilemma, it took the input and the perspective of several members of the interprofessional team, which, as we've learned in our course point modules, is essential in being able to provide holistic care and perform that, that full problem solving and root cause analysis where we get the full perspective and everybody can kind of come out with a win, essentially, when it comes to a conflict. We saw several issues during the nursing supervisor shift that dealt with staff burnout, maybe, ethical dilemmas, especially when you think about the story that I mentioned earlier with the PCA pump. Really, all of these experiences help to highlight how often nurses face complex decisions that maybe don't always have black and white answers. Leadership also isn't about avoiding conflict. It's about being able to take that problem or that dilemma, what have you, that argument, and navigate it ethically in a way that collaboration and teamwork are never out of mind. It's about coming together and solving the problem in a way that advances the outcome for everybody. This also ties into Provision 4 of the Code of Ethics, which states that nurses are accountable for their practice as well as for making sound ethical judgments. Being prepared for ethical dilemmas is a cornerstone of safe and thoughtful leadership. And it can't be stressed enough, and we've learned this through our textbook readings and our course point modules, even the case studies that we've completed. Conflict is essential for growth. You can never avoid conflict. It's always going to happen naturally. So it's best to kind of approach it in a way that turns it into a learning experience and creates benefits and positives in growth for both parties. Just to wrap up, this clinical really did help me grow into a more reflective, ethical, and intentional nursing student. I got to see many different settings for patient care, and I got to see firsthand that leadership does really show up in many forms. And whatever that form is, it's always grounded in empathy, advocacy, and integrity. I'm truly grateful for all of the guidance that I've received this semester, and I'm excited to take the lessons that I've learned into practice as a future nurse. So thank you so much.